Hi guys, this is Dr. Kelli Josephsen. I'm a physical therapist and I coach high school sports. I'm also a certified sports metrics trainer. I just want to do a little introduction video, tell you the story of how I decided to go into PT, my kind of journey through my own physical therapy when I was in high school, and how I kind of got to where I am right now. So when I was 16, I was playing high school basketball and I was going up for a layup. It was our first scrimmage of the season. And I was going up for a layup, and as I was going forward, my defender was coming out, and she put her hand on my elbow, and I went forward, and she kept going, my backwards. And as I was going up, I heard almost like the sound of like a ripping piece of paper, kind of in my shoulder area here. And I don't remember if I made or I missed the layup, but I remember kind of feeling like a little bit of a pain going through it, but it wasn't excruciating, and it wasn't terrible. But I remember looking over at my athletic trainer and saying, hey, I think I got to come out. I think we should check this out. So I got off the court and we iced it a little bit. He did his assessment and it was, it wasn't painful. It wasn't, swelling or anything crazy. So he said, okay, let's ice it. We'll look at it tomorrow. We'll see, what we think is going on through there and if we need to get x-rays or if, we can keep playing with this. So I forget what happened the next day, but I must have been okay. I must have felt all right because I ended up playing the whole season with whatever was going on through there, and it never really bothered me. There were some times when I'd reach up overhead and it would feel kind of unstable, and I just, I wouldn't tell anybody about it. But I played up through our whole season. Our first playoff game was in March, so the original injury happened, early December. Played until March. I pulled a rebound down, first playoff game. I felt my shoulder pop out. I threw the ball out of bounds, grabbed it, popped it back in, and my whole family was there, and they were like, that was weird, you've never done that before, what the heck is going on through there? So we had an x-ray and I saw my orthopedist and we ordered an MRI, and the long story short was that I had torn a structure in my left shoulder. It was called my labrum. And the reason that it didn't hurt me is because the labrum is more a stability structure than it is a contractile structure. It's not a muscle. It doesn't, the only reason my range of motion was affected is because way up here is where your shoulder's in a less stable position. So that's why I felt that instability through the season, but I had full range of motion, I could still play. So, my options at the time, I was a three-sport athlete. I played soccer, basketball, and softball, and this was around beginning of March. I talked to my surgeon, who's a great doctor at the Hospital for Special Surgery in New York. He said, listen, if you want to get back to high-level sports, we have to operate on this. This isn't going to heal itself. You might be fine without it, but you're not going to play at the level that you want to play at. So, I cried, and I was upset, and my parents were upset, and my teammates were upset, because I knew I was going to miss all of softball season, and I was hoping to maybe be back by soccer. I was a goalkeeper in soccer, so of course that's the one position where you need your hands. So that was my goal, to be back for August or September for soccer season. And what I realized in that time, I had the surgery, no complications, thank goodness, and everything went well. And then maybe 5 or 6 days after that was my first ever physical therapy visit. I didn't know what to expect. I didn't know what to wear. All I knew is that it was kind of sore and it kind of hurt, and I wasn't really supposed to move it. So I was stuck in this sling for a long time. After surgery, I was icing it. I was doing all the things I was supposed to do, but I wasn't sure what physical therapy was going to be like. And I remember going in and sitting down with Mike, my physical therapist, and my mom was there too, and he asked about the injury and the surgery, and I'm sure he had all the reports and everything at the time. And what I loved about Mike was that he wanted to get to know me. He knew I was this high school athlete. I was 16. I was playing varsity sports. I had 3 sports going for me, and he really took the time to get to know me. So fast forward a couple months, and I had seen my surgeon maybe once or twice in that time, whereas I had seen Mike 3 times a week for at least half an hour, sometimes up to an hour, sometimes even more. Again, 3 times a week for those first couple months. And what I loved about that was that Mike could ask me, hey, Kel, how was your mom's birthday the other day? Or, how'd the driver's test go? Or how's the softball team doing? And he knew a lot of things about me. And he knew when to push me, and he knew when to lay off me, and he knew when I was having a good time, when I was having a tough time, and he just knew who I was as a high school kid. And I saw my surgeon in that time, in the whole month periods that I was in PT for, I maybe saw my surgeon 5 times. And every time I went in, it was quick couple-minute visit, okay, check your range of motion, check your strength, all that good stuff, everything looks good, keep up with the PT. And so that's when I kind of realized, maybe I could go into PT as a living. Maybe I could do this and help people and get to know people the same way Mike did with me, and help them get back to the things they love to do, to the things that make them feel, the most useful and really bring them alive. So that's what I did. There were some colleges when I got to my senior year where you could apply and do like a 6-year program, so you could go in and do 3 years of undergrad and get a degree in exercise science or physiology or something like that, and then go right into the Doctor of Physical Therapy program. But myself as a high school senior, and not really knowing if I wanted to commit to that quite yet, and also not knowing if I wanted to play sports in college, decided to go for a 4-year degree and then the 3-year degree Doctor of Physical Therapy degree. So that's when I started up at St. Anselm College, which is a little school up in New Hampshire. I walked onto their basketball team. That was Division II. And then after 2 years there, I was in the science program and decided, it wasn't the right place for me to be in school anymore. I needed to be somewhere where I could kind of fully pursue everything I was passionate about. So I transferred to schools down to Catholic University in Washington, D.C., where I played Division III basketball and had an awesome time. I was in the biology program there. DC was a great city to be a college kid in, so I really enjoyed my time there. And then when it came time for graduate school, I got accepted up at MGH up in Boston, and I headed back north for 3 years, where I pursued the Doctor of PT degree, and I loved it. It was amazing, and now I'm back home in New Jersey. I practice in a town a couple towns away from mine, and I coach high school sports, so I'm here at Mount St. Dominic Academy, and I coach soccer and basketball. Found myself helping out with softball, so you could say I kind of eased my way right back into things, and that's where I am now. So in my time now as a physical therapist, in this year or so that I've graduated in, I've really developed a passion for helping people through injuries, helping people through the psychology of their injuries, because I remember what that was like for me. And I'm learning that the best way to treat an injury is to not get it in the first place. So there's a special place in my heart for injury prevention and for keeping my players and our players and our my patients out on the fields and out doing the things that they love to do, and teaching them the safest ways to do that and the preventative stuff and the risk reduction things that they can do to stay out there. So that's kind of my story, guys. I just want to get for you to get to know me, for me to have the chance to get to know you. Like I said, the best part about being a PT is the relationships that I get with my patients. I meet new and interesting people every day. I love hearing people's stories. If there's any way you think that I can help you, please don't hesitate to reach out. If you're a patient, if you're a student, if you're a physical therapist, if you're wanting to learn more about the field or more about what I do, please don't hesitate to reach out. All right, thanks so much, guys.